Alright, so welcome to today's webinar, and I want to talk to you today about diverticulosis. And this is a very obstinate disease in today's time. First, let's try to understand what is diverticulosis. It's a kind of it arises from a lot of muscular incoordination and spasm, and especially due to the intraluminar pressure. And what basically happens is in diverticulosis that you can see it's a kind of a prolapse, kind of a swelling kind of a situation. While in diverticulitis there is an inflammation as well, which basically causes a lot of pain and heaviness sensation. Especially there could be in the left iliac fossa. And what happens? The colon becomes thickened, almost like a tender mass. Patients who are getting constant distension, flatulence, heaviness, and very often some of them can also cause bleeding per rectum. The way to diagnosis is basically nowadays we can only do a scopy. CT scan is done quite often. Barium enema is done. There can be complications like hemorrhage. There can be intestinal obstruction, intussusception. And most of the allopathic doctors would suggest you about diet and about maybe at some point surgery like this. However, what I wanted to share with you is homeopathy has results in this type of disease. There are some cases in diverticulosis where homeopathy is able to stabilize the condition for years. What in homeopathy is very important, and it's very important to understand, is that very often this kind of thing happens due to a lot of stress in today's world. Our lifestyle, the way we eat, the way we drink, the way we live our life. And in homeopathy, we go step by step in different parts of a person's history. And very often we find out that there has been a lot of stress, an exciting factor after which many symptoms have started. Which essentially means we try to find the deeper state. I want to share with you a similar case which really improved dramatically of diverticulosis with homeopathy. So it was a case of an old lady, 62-year-old lady, and she was diagnosed of diverticulosis, and all her scans showed big increase enlargement in the colon, like a tumor-like mass. She would develop a lot of flatulence, diarrhea, pain, swelling. All enterologists, gastroenterologists would suggest was do surgery or do this diet. Or when I tried to understand her history, there was a lot of stress involved. And what was the stress was that she would always go out of the way to help people. She was this very caring, affectionate, loving lady who would always go out of the way to help people, to her son, to her family members. But now, from the time she has got old, no one cares for her. She feels very forsaken, unloved, no one to talk to, disappointed. And because of that, she has become very indifferent, doesn't want to talk to anyone, almost built a wall against herself, doesn't want to meet anyone, developed dullness, indifferent, listlessness. Even state of mind has become very, very dulled. She has gone into mild depression, allopathic doctors giving antidepressants. And that is where she came to see me. In homeopathy, we try to understand this deeper state. And this deeper state in homeopathy matched with a homeopathic remedy, that is phosphoric acidum, the main symptom of which being unwilling to speak, indifference, apathetic from unequal struggling from adverse circumstances. And this is also the idea of phosphoric acid, where there is a lot of care, love, and they don't get it, and that causes the indifference. With phosphoric acid in 1M potency, every month I would follow up and give the medicine. In 8 months, all her allopathic medicines have been stopped, even the antidepressant, and even her clinical symptom of flatulence, digestion. Even the sonography shows now changes in the diverticular. It's a remarkable change. It is very important to explain the person about the emotional state, which also helps. Homeopathy has remarkable results. You can write to me, gaurang@gmail.com. Thank you.